Hello everyone, happy to see you again. Thanks joining us today. And this is the fourth session, the last session of our online short course of nursing informatics. And it's our honor to serve audiences from different countries. Thanks joining Tom's. As you remember, the other sessions which we had last week and before that, the first one was about nursing informatics principles, and with a great lecture of Dr. Tania Azadi, my colleague of TOMS. And the second one was on Saturday, February 27, with the subject of nursing informatics competencies, with a valuable lecture of distinguished lecturer Professor Tony Hebda from USA. And after that, we had another session with Dr. Melody Rose, distinguished and with a very new subject and valuable lecture about standardized languages in nursing and nursing informatics. Today is the last session. We have the honor to have a very distinguished lecturer from USA, Professor Caroline Sipes, with the subject of future of nursing informatics. First, I want to ask dear host to launch the poll. Would you please, host? Okay, thank you so much. Thank you. Please, participant, read the questions and answer these per-lecture questions. Then these questions will be repeated again after the lectures of today. Thank you so much. 57% of participants answered the poll. It's 62% answered the poll, and the dear host, I think it's okay, and you can close the poll. And we look forward to a valuable lecture of Professor Sipes from USA. We will start it.
Hello and welcome to Preparing for the Future of Nursing Informatics. I am Dr. Caroline Sipes and have previously worked with Dr. Hebda at Chamberlain University in the informatics program, where I was the lead for the development of the graduate level practicum experiences for the students there. As they developed their projects before they graduated. And then Dr. Hebda and others have invited me to write and publish a number of chapters in her book, which she has previously presented, the Nursing Informatics in Health for Health Professionals. So I have developed and presented, written the chapters, several chapters in the Hebda's book. I first introduced the concept of project management in chapter 9 under strategic planning, because that is a new and evolving process and skill requirement for nursing informatics professionals and informatics nurse specialty in the specialty practice for today. So with that, I am going to be presenting that new concept that is being more accepted throughout all of nursing, and especially within the nursing informatics and informatics nurse specialty roles. So I'll be presenting that information today. With that, I would acknowledge the providers for this, the faculty and administration of Tehran University Medical Sciences School of Nursing, who invited us to be presenters and present the new information that we are currently using and implementing within the United States. So again, thank you, and we acknowledge that, and thank you for inviting us as speakers. With that, I would like to review the objectives for this presentation. We will be discussing the future thinking and concepts of nursing informatics, as I mentioned. We will be reviewing the new ANA scope and standards of nursing informatics. I have been on that work group to revise and update the ANA, American Nurses Association, scope and standards for nursing informatics for the past 2.5 years. And we finally have a product that has gone out for public review and is currently being accepted and written as the new ANA scope and standards of nursing informatics, which will come out yet this year, 2021. So it was delayed a bit due to the COVID pandemic, but is now moving forward. We will also review an example of the DNP AACN practice essentials. That's the American Association of Colleges of Nursing, who have also updated the practice essentials in 2021. And I'm going to review just a few of the essentials. The reason I am presenting the DNP level is because we essentially start out at a higher level for a number of these implementations. For example, the informatics scope and standards at a graduate level, and then the DNP essentials at a doctoral level. And then these are typically, after they've been in place for a number of courses over a number of terms, are moved down to the lower students in like beginning master's level, and even as they, Dr. Hebda might have explained, have moved down into the baccalaureate BSN graduate level courses. So again, we start at a higher level, essentially perfect it, use it, and then essentially move it along with higher expectations for the next level of practicing nurses. We're going to be discussing an Exemplar technology graduate course that I have developed with new technologies. And again, this will be also presenting what the students at this graduate level course will be reviewing. Again, new technology. They will need to understand the nurse informaticist role in this new technology. What are some of the responsibilities of a nurse informaticist? And that goes to exploring the competencies required by all nurses. And we'll be reviewing the future practice requirements, which again is new. The project management is new. Essentially understanding what that concept is, and I'll relate it to the nursing process, which you already probably are very familiar with. We'll also discuss the new informatics skills and strategies for implementing these new skills and knowledge into practice. So for the nursing informatics competencies, again, this is recommended for all nurses. It's being required by many of the organizations who are beginning to really recognize and understand the value and skills of a nurse informaticist and an informatics nurse specialist. They're also recognizing the needs for these project management skills. It's not just necessarily the nursing process and the skills at the bedside that organizations are recognizing and requiring, but they're also requiring, and to some extent expect, that all nurses have some concept and background of project management. So again, we have an education potential there to evaluate higher level and educate higher level organizational leadership, such as the CEOs and COO, that we do and can work beyond the bedside, and we do have those skills and knowledge. And again, I'll go through that and share how it correlates with the nursing process, which we all are very familiar with. And with that, we're going to review why you need to understand the informatics competencies. And again, it's to build essentially on the need for all nurses to understand. And again, there are many organizations and publications out there that say that and put forward that all nurses need informatics competencies. And the reason is because of the evolving and evolution in technology-laden healthcare delivery systems. Can you imagine if you were not familiar with the informatics competencies and skills, if you were asked to move to using a new electronic medical record system within your organization? This is where the informatics competencies come in. And again, I'll cover more about what those are in a few minutes. Again, this is an evolving nature of practice. Again, the expectations by leadership in the organizations is that nurses do know how to do this. They are competent in this, and they do have some project management skills and knowledge about project management, which essentially has evolved from the nursing process, again, that we all know. So there's a shift to the evidence and outcomes now. Organizations have to comply with Medicare rules and demonstrate quality outcomes. There is an increased need for the organizational framework, such as an organization. There's a process that you go through step by step by step in order to complete different types of processes and work activities. There's an increased focus on collaboration and communication, and I'll go through more of that. Tools, with examples of tools, as how this can be documented and followed and tracked, which is really important. The focus on collaboration, now more, the emphasis is on interprofessional collaboration, not just nurses to nurses, but nurses to all of the other disciplines, where we are collaborating and sharing information back and forth. So there's a need to extend provider capabilities, such as improving skills and knowledge for all nurses. And again, this is where I mentioned earlier that we need to educate all levels of providers about what we really do. In my practice and working with graduate students, I've found that many times leadership in these organizations assume that the nurses have project management skills. They know how to monitor and track. They know how to implement a number of the different processes that I'm going to go over. And it's so I think our opportunity there is to educate leadership beyond what we do as nurses at the bedside, and we do have these other skills and knowledge that should be taken advantage of. I'm going to be covering the new concepts of project management, and in terms of project management knowledge and skills. I mentioned earlier that the new nurses' roles as informatics project manager has been emphasized and published in a number of entities. And I'll read from you from Dr. Hebda's book on page 161. as far back as 2016, the Health Resources and Services Administration, the HRSA, in the United States, HRSA is the acronym, stated that management and implementation of an EHR requires skills in leadership and direction of a project team that many few possess. And again, this is what I've been talking about. We've been talking about why it's necessary for nurses at this point in their career and skills need to obtain the project management skills. Furthermore, many nurses view the concept of project management as foreign and not applicable to anything that they do. In fact, the NI role in a project manager follows the process, again, that is very similar to the nursing process. And again, I'll go through that a little bit more in a minute. The concepts, again, are very similar, as I'd mentioned. For example, the 5 steps of the nursing process are equivalent to the 5 phases of project management, and both include the first step, which is assessment, in which analysis of what is and what needs to occur is assessed. And I'll go through again further steps in that in just a minute as we go through and I compare nursing process to the phases of project management. So with that, and again, this is to review some of what Dr. Hebda presented. The Informatics Competencies are defined by skill levels at all levels, including starting with the beginning nurse. And this is where many in leadership, higher level leadership in the organization think that we nurses typically only have the skills to take care of patients at the bedside and not much beyond that. The skill application and another level is the experienced nurse. And again, this is where it's been practicing for years and employing the nursing process. The skill application level nursing informatics specialist is a level 3, and an innovator is a level 4. And even nursing informatics researcher, there's new information out just in 2020 that project management skills and tools are being used in nursing research at the doctoral PhD level. And I've put a reference in here for you to check and see how the different project management tools and processes were implemented in this nursing research project that this group did by REW, as listed here below. So again, we're looking at the categories of the competencies, and again, Dr. Hebda covered this as basic computer skills. Again, this used to be more of a focus originally for nurse informaticists, that they primarily did data management. But I think, as you'll see now, we've moved well beyond just nursing informatics as a data manager to other skills that are needed. Informatics knowledge will include the discipline of project management. And again, there's a strong correlation, which you'll see visually in a minute, of correlation to the nursing process. Informatics skills, the new concepts and skills will include project management skills and tools. And I have, in Chapter 9 in Dr. Hebda's book, reviewed this, and I've also put a number of the tools, examples of the project management tools in Appendix C in her book. I have listed essentially 55 of the tools that my students and I have both used in my project management book, which is Project Management for the Advanced Practice Nurse. So by way of review, looking at the 5 steps in the nursing process that are typically used as a new nurse. We've all learned this as a new nurse. The nursing process as we develop a care plan to manage a patient's condition. As they've come in, the first step is assessment of the patient, what's going on. The nursing diagnosis, this is the problem identification. Again, really understanding what their diagnosis is and the problem. Then putting together a care plan based on the problem. How can we best support the patient as the problem is identified and treated? How are we going to implement that plan, that care plan? And then how are we going to follow along and evaluate whether what we've suggested and put in place as a care plan is really working. So the constant evaluation of the patient's condition is part of that nursing process. And again, each step needs to be completed, obviously, before we can progress further to the next steps. Again, you would put a care plan in place before you could even begin evaluating what's going on with that patient. So with that, these are the 5 phases of project management, and I mapped them to the nursing process so you could see the similarity in terminology and essentially the same processes. So the first phase of project management is to do a gap analysis, essentially understand where the gap is in the project that you're going to be working on, the activity that you're going to be working on. Why are you doing it? What are the gaps? What can you do to fix it? So again, that's a gap analysis, which I'll explain a little bit further in a minute. And I also have an example of visualization of what a gap analysis might look like. One thing that's done in the first phase of project management, similar to the nursing process, is you develop a scope and a charter. That means it defines exactly what you will do, what you won't do, what's appropriate to not do within this plan. And the charter, again, these are legal documents, and we're just implementing this process in a doctoral program, a DNP program. And the project scope and charter will take a place, essentially, since they're legal documents, will take place of an IRB approval, because the project scope and charter is signed off by the organization leadership that agrees with what you're doing, and also a faculty member who is going to go along and provide oversight for exactly the different activities and steps that you're going to be completing. The next phase in the project management is planning. And again, similar to the care plan, you define what needs to be done, and you document that. Then you implement that plan. You put that plan in place, and you monitor it as you go along, just again, as you would in the nursing process. You put the care plan in place and you evaluate it. You're constantly reviewing the patient progress toward getting better. It's the same thing within project management. You implement the plan and you need to monitor it closely to make sure that what you've done and what you've recommended is really working. So continuing with the 5 phases, phase 4 is the monitoring and control. Again, that's that ongoing assessment that I mentioned, and specifically looking at quality of what you were doing, your activities. And again, this is a really big issue now, more with organizations, is the quality control. Is it Is it really helping and moving forward? Is it going to solve an issue? Is it going to solve a problem? And then after you have implemented the project, you've made sure that it meets all of the requirements, things are moving along, you close out the project just as you would putting together a discharge plan for a patient. You close out the project, you evaluate it, and you review and reflect back on lessons learned. You know, what really went well, what did not go well, what would you not do the next time around? You know, what part of the plan did not work? So again, that's really important in part of that quality monitoring. You know, did it really work? And if so, could pose as a perfect model to follow along and implement, you know, the next time you identify a similar problem. What I'd like to explain here is the NICA, which Dr. Hebda has already presented to you. It's the level 3, level 4 competency levels that we evaluate the self-assessment of nursing informatics competency assessment, and level 3, level 4, which is at the innovative level, and this is what we're looking at for the more experienced graduate level as they're completing a master's degree and into a DNP program, doctoral level program. Again, this is for the graduate nurses. The next things I'd like to cover in the next few minutes are the ANA standards of practice, which includes new information on project management concepts for the informatics nurse and the informatics nurse specialist, and the ANA standards of professional performance, which again includes the project management concepts for the informatics nurse and the informatics nurse specialist. And again, I'll show you how I've mapped that to the standards of practice. Again, these are the new standards, the 2021 standards that are just coming out of our ANA, American Nurses Association work group that we've been working on for about 2.5 years. And I will also present the new ANCC essentials of the nursing DNP program, Doctor of Nursing Practice program. These are also new essentials 2021 from the American Association of Colleges of Nursing. And I listed a few of them here. This is certainly not the complete list of them, and you can go in and find those online if you look under the AACN Essentials. But the ones that specifically are geared toward implementation of project management skills, knowledge, and concepts are the organizational and systems leadership for quality improvement. And this is what I'd mentioned, that typically our DNPs do quality improvement projects where they evaluate a quality initiative that's been implemented by an organization, analyze the data, look at the outcomes of that data, and then make recommendations for clinical practice change. Another key essential for the DNP program is looking at information systems and technology, as well as patient care technology for the improvement and transformation of healthcare. And these are very specifically related to project management concepts and understanding the knowledge and skills that essentially go along with those. Examples of the project management tools and processes that I've been talking about and already mentioned a few of these are the scope and charter. Again, it's where essentially the project proposal is developed and put together. It's where the project is defined and the project is authorized, signed off by leadership like the CEO and the COO. And again, these projects are activities and projects that an organization has asked a student to evaluate, do the gap analysis, evaluate, and then make recommendations how some problem could be addressed and fixed, and then move forward with that. This is done for our groups within Chamberlain. I developed this to go along with the master's practicum, final practicum, in as the students developed their final expertise so that they would move forward as an informatics nurse specialist. At the lower level, the informatics nurse is more in our bachelor's degree levels. And what we're doing new now at the other university that I am now with, Walden University, another international university, is to put these concepts and skills into the DNP program. And the reason we're moving forward with that is because the organizations, the healthcare organizations, have asked that students do something that where they will develop the skills and knowledge that are more applicable to some need the organization might have after they graduate. Then they can step into a management, higher level management role level and assume some responsibilities for quality improvement within the organizations. So that is the concept and the rationale behind developing this type of thing for the DNP, the doctoral nursing practice, the clinical practitioners. So more on the project management tool and processes. Again, I originally discussed the scope and charter, which is essentially where you outline exactly what you're going to do. After the gap analysis is completed, you've defined what the problem is, and you're going to make a recommendation for how you're going to resolve that issue. The other tools are the work breakdown structure, where the overall project has to be broken down into the many steps that it will take to resolve the problem. For example, you define it. You have to define the resources. You have to put together a team. You have to work with whatever resource it is that might be able to come in and essentially fix the issue. Different things like that. You need to put together what's called a Gantt chart, where the activities are listed with due dates, the start date and the end date, so you know exactly how the project is moving along. And if something is missed, then you need to address it very quickly to make sure that it's not going to delay the whole project, because organizations are very much in tune with getting things done, meeting deadlines, because again, it also impacts their bottom line and resources and funding. So it's a very important activity that students learn to accommodate, assess, put in the due dates, and make sure that things are on track. The communication plan is another tool, and this is critical. We've discussed the need for how important communication is, and I'll go through, and I've got some examples of these tools that I'll go through with you and share how they might be used. Another huge activity that needs to be very closely tracked is risk management plan. And this is something new that the AACN Essentials has added, that advanced nurses need to know. They need to know how to assess for risk and to address and fix essentially a risk. So again, this is something new for 2021 that the AACN has identified as a really necessary skill. Another tool is the responsibility matrix that students will put together, and this defines exactly who is responsible for what, and with a due date, because again, sometimes within projects, and I'm sure you've all seen it, that someone will come up and there's a project that's supposed to be moving along and something falls apart and say, well, who was responsible for that? And it's like, well, I don't know, because it may not have been documented who was responsible. So putting together who is responsible for what, a responsibility matrix, is very important. And then certainly, again, along with the communication, are the weekly status reports. And these are written reports that are presented to everybody involved. And again, the key here is, again, and we learned this as nurses, if it's not documented, it wasn't done. So that same process and philosophy applies to project management and, managing any kind of an activity that has a start date and an end date, that it needs to be documented. And I think we all know that well. This is an example of the NICA tool that Dr. Hebda had shared with you originally. And again, this is at the higher level. There's a lower level basic assessment tool that we've developed. It's called the TANIC. It's a Tiger Self-Assessment of Nursing Informatics Competencies, and we started out using that at the master's graduate level, and then moved it to the beginning master's level, and it's now in the BSN, the lower level beginning basic nursing courses for an assessment of informatics skills. So this is the NICA, which is the advanced self-assessment tool that we have, that many other countries have also used. It's being used in all kinds of research. And you can see here within the role, their project management concepts and skills listed here. Influence change to improve and impact informatics on a system, and that's part of project management. Design strategies to manage and impact change. And again, that was phase 1 of project management. Consult, again, that goes under the communication plan of project management. And the last one, serve as a liaison among agency departments and vendors. That goes to a leadership standard that I will discuss in a bit. And it goes to all nurses having some component, exhibiting some component and responsibility for leadership. So this was the NICA tool that Dr. Hebda shared with you earlier. This is an example of a scope document that I talked about earlier. This outlines exactly what's to be done, who the sponsors are, who's the project manager, who's going to be responsible for making sure everything's on target, measurable project objectives. As you go through and put something together, it's like, here's what we're going to do, here's what we're not going to do. And again, it's documented, it's tracked. Is it being done? When is it due? And then measures of success, part of the scope document. How are you going to measure success? Was it completed? Did it meet the due date? Was it on budget and on time? Was it successful and really addressed the issue and solved the problem? And again, this type of document is a legal document that's signed off essentially by the CEO of the organization, and along with a faculty advisor for the students. So you can see that this follows along. There's a faculty advisor from a university that's involved in providing oversight, as well as the communication and oversight from the organizational representative. This is the gap analysis that I discussed earlier. This is something that you will do at the very beginning. It's essentially your assessment. Again, go back and think about the nursing process. One of the first things you do is to need to understand what the problem is. So in completing a gap analysis, you define where you are. It's called current state. And then you define where you want to be, where you need to be. And that's called the future state, essentially, in some of this terminology, if you were to read articles on this. And then step 4 is, what's your plan to bridge the gap? How are you going to solve that problem? So essentially, this is a gap analysis. It's called a workflow analysis. It has several different terminology associated with it, but it's something that really needs to be done at the very beginning. So you will be doing a gap analysis. This is a communication plan, an example of what it might look like, and you document. This is done and completed and updated and tracked at least on a weekly basis. And so you define who the team members are, what is the preferred format of communication. If you're going to have weekly status meetings, you need to understand how the CEO might want emails, or he might want a text message, or an actual verbal communication. You need to define all of that and keep it updated in this type of a plan. And then how frequency. Maybe the CEO of the organization only wants to be notified once a week, where somebody else might want to be notified 2 times a week, something like that. So again, this is another tracking document that's used in the project management plan. Again, monitor and control weekly report. This is something that's really critical to monitor. What is the process? Is it on time? What are the, what might be a problem? What's not happening? What's not getting fixed to keep it move forward? And again, this has the risk management component also identified in this. So again, that's something that the AACN identified as an essential for an advanced practice nurse, that would be the informatics nurse specialist, to really be responsible for this. It's a really big job and carries a lot of weight with it, but also need to be really on target and understand exactly what's going well and what's not going well, and communicate that quickly to make sure that a project does not fail. This is what a weekly status report might look like. I use this a lot as a project director for all of the projects that I provided oversight for all of the different organizations nationally and internationally. And I essentially developed this when things were not going well when one organization in a northern state in the United States, and it was difficult to be getting physicians involved in working with us in an oncology unit. And when they saw this visually, I got much better response from them to participate in getting their orders in timely, attending weekly meetings, that type of thing. If they had their name here with a red mark, they really tended to step up and participate much better. But again, the red means the project's not meeting the progress criteria. It's well behind, weeks behind where it should be in getting the different tasks completed and moving forward. And you can see the yellow is okay with there, but there's some risk. And then the green, everybody liked to see and have green dots next to their name, that they were really, as a stakeholder, a physician, were really helping to support to get their orders in and done. And in these EHRs, where the medical records and the CPOE medical records were included, and med orders were included. So this was really worked well to keeping people on target. So the other thing that I had mentioned earlier was that I wanted to share with you an exemplar of a technology course that I put together that's we're now looking at for the doctoral level course. And because, again, this is where there have been some requirements for the informatics nurse specialists and certainly the DNP nurses working more with quality improvement to have a full understanding of what the technology is now, today, and even in the future for 2025, and what their roles might be, what they need to learn, what they need to do to get up to speed with the different emerging technologies. And I put some references here from where I pulled some of this information, and you can always look at this and see that there's much more out there. I only pulled a few examples of this. So artificial intelligence, again, you've probably heard that, but it's becoming more and more involved. It's being used now against COVID. And it would be really interesting for you to read the articles on artificial intelligence and how it was used to track COVID and the different, how the vaccines were being developed and how patients were being tracked and the vaccines implemented, that type of thing. So there are some really interesting articles out there at these websites that you might want to review. Biometrics is another technology to review. The virtual and augmented reality is really interesting. If you review that, you see that that's been used in nursing homes to really help with dementia and stroke patients. And they, it'll be interesting to see how that's used to help move these patients back to more normal functioning. The Internet of Things, there's the Internet of Things, there's Internet of Medical Things. It's, they're breaking that out into other levels of technology that would be really important and interesting to review. Certainly telehealth really emerged. It's been around for a long time. I developed a webinar on telehealth, and in the middle of developing that last March, all at once, it hadn't been used and there were barriers to using it. Then all at once, effective March 15th of last year, it was being mandated by our federal government that all organizations stop the face-to-face visits of patients for patient care and start using telehealth. So that was really interesting if you look at how it's really emerged. And one of the new things coming out of telehealth is called Docs on Call. So that's something else that you can review and read about, which I think is fascinating. Certainly idigital health is big, and this refers to the wearable fitness devices. These are like the iWatches, and now there's new capability of tracking that data, being able to access and track that data, including, like heart rate, respiration, different things like that, fitness levels. And then there are all these new companies popping up that are developing ways to access and analyze that data, which is certainly where nursing informaticists can come in. And I mean, there are all kinds of opportunities here for nursing informatics. Smartphone health apps, again, can generate the continuous streams of data that goes along with the wearables and the essentially the watches, the iWatch, those type of things. There will be quantified health metrics, again, more data analysis, trending data, statistics in doing qualitative and quantitative research involved there. And then another interesting technology I thought was interesting is the 3D bioprinting, where they can print, bioprint, 3D print new organs and veins and that type of thing. So I think, again, looking at this and understanding that these are all of topics that I've put in the technology course that I think the informatics nurse specialist and the doctor of nursing practice, the DNPs, need to explore so they understand when they graduate and go out there and working with an organization that these are possibilities that they'll be seeing in their new practice. So with that, I want to move into the nursing informatics scope and standards, and specifically the standards of practice. Again, these are new. These are will be published, going out for publication now, which will be the 2021, excuse me, standards of practice. And again, I have mapped these to the different project management phases. Again, this is something new, completely new, that you'll see in the new scope and standards. So, and I again map them to the specific standards that they would match. Standard 1 is assessment, and as I've mentioned before, this maps to phase 1 of project management, which is the gap analysis. Essentially, you're doing an assessment. What's the problem and what's needed, essentially, to fix it. It'll be the collection of data, information, and evidence, as the first step of the nursing process. It is also the first step of project management. Standard 2 is diagnosis, problems, and issues identification. And again, this is identifying the problem, as I mentioned, and this maps to, again, the gap analysis, identifying what the problem is and identifying what the issue is so that you can take action and essentially put a plan together to move forward to address the problem. Standard 3 is outcomes identification. This would be more for the phase 2 of project management, the planning phase. You need to identify what you think the potential outcomes will be. Again, this goes to the scope of what the project is and what what you will do and what you won't do and what you're anticipating the outcomes of the problem resolution will identify. So that will drive development of an individualized plan. And again, that's the planning phase of project management. Planning is very definitely, I think this speaks for itself. This identifies with and maps to phase 2 of project management, planning. And this is where you spend a lot of time in project management. It's one of the most intensive areas, is establishing the details of the plan and the activities that you need to move forward with to accomplish that, the steps that you need to put forward and address to develop a plan and put that plan and implement that plan. Standard 5, and this is actual terminology that's in the nursing informatics scope and standards. And again, it maps to phase 3 of project management, implementation. Standard 6 of the scope and standards is evaluation. And this maps to phase 5 of the project management, which is closeout, final evaluation, lessons learned. You go back and forth and back and forth. What went well and what did not go well, and essentially, what would you do again that worked well and not do. And I listed the previously scope and standards, I only listed a few of those total. For the informatics scope and standards, there are 15 standards of practice and standards of professional performance. So I'm only listing a few to give you examples of how project management really maps to the informatics scope and standards. So next we're going to be covering the standards of professional performance. So with that, standard 9 states that you need to implement evidence-based practice and research, and this should always be the foundation of all nursing practice. This maps to phase 2 of planning. It confirms that you integrate the evidence and research findings into practice. So you would research during the planning phase, you would research what has worked well in the past and implement that to try to resolve the issue that you're moving forward with to resolve. And that would be, again, based on evidence-based practice. Standard 10 certainly is a huge component of the nursing standards and project management. This maps to phase 4 of project management, monitor and control. And that means you will be monitoring and the quality of what's going on within the project with every component of the project. Is this being put together correctly? Is it the right type of response to what the problem might be? So again, quality of practice, again, describes the expectation that the informatics nurse contribution will be related to quality and effectiveness. So again, this is a huge component now that the organizations are really looking forward to, and I think you've seen that or heard that maybe within our meaningful use standards of practice that our federal government essentially put out. And now it's more on what you did and how many you did. It's quality of practice. Are patients being readmitted to the hospital based on what you're doing? And there are penalties and consequences if you don't meet that quality of practice. Standard 11, communication. Again, this is huge. I've mentioned this several times. This is a main component of success within project management and, again, everything that we do. And again, this maps to phases 2 and 3, planning and implementation. It essentially maps to all 5 phases of project management and all 5 phases of the nursing process. Think of a time when communication would not be really important to maintain standards and performance, quality performance. I think you would probably come up with and agree that this really is critical to all components of not only the nursing process, but all of the phases in project management. Standard 12, leadership. This is another big area that is really being emphasized, that nurses, especially at the master's level and advanced levels, demonstrate leadership. And this is what the CEOs and the COOs of the organizations are expecting of nurses. It's not just, and I hear this time and again, that it's more than just the nurse at the bedside. They want nurses to really step up and demonstrate leadership. And this you demonstrate a professional practice setting as well as for the profession in general. This maps to all phases, again, of project management, demonstrating leadership in all roles. Standard 13 is collaboration. And I mentioned this earlier too, in terms of collaborating specifically needs to be interdisciplinary. With this, collaboration means you not only work within your nursing organization and nursing peers, but you work with other disciplines to make sure that something is completed and transparent and communicated in the best way possible to achieve the highest quality standards. Collaboration maps to project management, all 5 phases. You need to collaborate, work with others to get the best outcomes and highest quality. And final standard, there are more of these. I only chose a few that really related specifically to project management. And standard 15 is resource allocation and utilization. And again, this applies to from phase 1 to all phases of planning, implementation, monitor and control, all of the phases of project management, because it impacts safe, effective, and fiscal responsible informatics and services. So think about, time, budget, being effective in everything that you do with resources and planning and implementation, and how you're caring for your patients with the highest quality care possible. So with that, I'd like to move it to some questions and comments. I have 5 questions, considerations I'd like for you to reflect on, and we'll have a discussion.
Dear audiences, I should express my gratitude and thanks to Professor Sipes for her precious time spent on it. I really enjoyed the valuable lecture. Actually, this was a pre-record session which Professor Sipes prepared, and also she sent it with a good quality. And I again thanks for sharing your knowledge, dear Professor Sipes, and also thanks for having you in our session. Now I will run her next slide. That is also a narrative slide, which is included the questions. Please, if you write down the questions, and also we will repeat the question after the break. After these questions, we have a 10-minute break, then we come back, and after that, any one of you want to speak, raise a hand and speak about these discussions.
So with that, I'd like to move it to some questions and comments. I have 5 questions, considerations I'd like for you to reflect on, and we'll have a discussion. So I'd like to hear a lot of your comments and feedback on this. So question number 1, and you can write these down if you wish, but I'd like to hear some discussion and your thoughts on this. Number 1, discuss the value of monitoring to update the competencies in practice. And by this I meant, how important is it for you to maintain your most current practice and keep up to date? And you think about the impact of COVID And what if you didn't keep up with that practice, and what was new and what has changed? So with that, and as well as the informatics competencies and the technology that I presented, what if you did not keep up with that and you were out of practice for a while and came back, and then you're inundated with all of this new technology? So think about the value of monitoring and updating your competencies and implementing them in your practice. Think about how important it is to understand and use the standards as the foundation of practice. How would you implement these into your current practice? And how important is it to use standards of practice that have been worked on and identified as foundational to all nursing practice? Question number 3, as an informatics nurse, nursing informatics and nursing informatics continues to evolve, how will you employ the new project management concepts into practice? This one I'd really like to hear a lot of detailed discussion. Where would you introduce these new concepts? And by this I mean, would these only be introduced to you in a new course? Would they be introduced to you in your clinical practice by, with some learning module, something like that? How would you best like to see and have access to all of the new concepts that are coming about and being implemented and recommended by the main organizations, national organizations, in 2021? And the final question is, and again, I'd like to hear a lot of conversation and feedback on this. What are your thoughts on the expanded and evolving practice roles and the competencies of the informatics nurse and the informatics nurse specialist? So with that, we can go back to the beginning of the first questions and initiate some discussion. So with that, that is the end of my presentation, and now it's your turn to help us out and give some feedback on this, some thoughts. We really appreciate the feedback because it helps us move forward with what works well, maybe within our courses, and what would be something really great to add to the courses and update our courses. So as faculty, we really rely on this kind of feedback, the constant feedback, and we really appreciate your thoughts. Thank you.
Okay, thank you so much for your patience, and thanks a lot for a very nice subject and lecture. How a beautiful explanation of matching project management to nursing process and the scope and standards of NI. I really enjoyed. Thank you so much. Please, dear host, we will have a 10-minute break, and dear audiences can review the questions and write down which question you would like to answer or share your opinion, because maybe team, it was very nice a clip for our new year. 5 or 6 days we have till our new year, and have seen included a special 7S for Iranian New Year. So I hope you enjoyed that. I want to know if Professor Nick Bacht, our Dean of the Faculty, is online. It's our honor to hear speaking for 5 minutes. If you are online, please, I should say thanks to Dr. Nick Bacht and Dr. Seilani and all lecturers for supporting and helping to run this program. Is Dr. Nichbach on?
Dr. Darvish, hello, Dr. Darvish. Do you hear my voice?
Yes, please continue.
Hello, everybody. Thank you, Dr. Darvish. You talked about the Nowruz, and I would like to happy Nowruz to all participants. In advance, Nowruz is the beginning, as Dr. Darvish said, the beginning of the Iranian New Year. So first of all, I would like to say Happy Nowruz and appreciate the distinguished professors and expert team and lecturers who helped us to conduct this online course on nursing and informatics. I would also like to express my sincere to executive team, Dr. Darvish, Dr. Azadi, Dr. Seilani, the Vice Team for International Affairs of the school, and all participants from different countries who joined us and accompanied us in this program. And also many thanks to our technical team, Ms. Sadeghi, Ms. Alauddin, and also Ms. Nafise Ismaili and Ravande, who helped us during this program. Professor Hepta, Dr. Rose, Professor Sipes. Thank you very much for all your participation, your scientific and valuable lectures during these weeks of running this program. We hope that these short courses can draw your attention to the importance and necessity of the nursing informatic in modern and technology-based nursing services. And now it's a good opportunity here for me to announce that TUM's School of Nursing and Midwifery is going to establish master degree in nursing and informatics next Iranian year, as Dr. Darvish will be start from the next week, the beginning of the next week, as a joint degree program with another prestigious university. And I hope all the participants satisfied with this part and see you all in the second part, advanced part of this short course after Nowruz, and also participate in master degree program, which would be a joint degree program with between TAMS, Tehran University of Medical Science, and another European or Western university. Thank you all. Thank you, Dr. Darvish.
Thank you so much, Dr. Nichbach. I'm so happy for this successful program and your support. Thank you so much.
You're welcome.
I want to ask participants, please, if any one of you is interested to answer questions of Dr. Professor Sipes, it's the time and you can speak shortly, or some of you can just write down in the chat box. And also, these questions are included in our questionnaire, which the link is shared in the chat box. And you have more time to study or think about them, and send your answer in detail to the Google form. But if at this time any one of you is ready to talk about these questions, we will be so happy, and we will send your answers which you enter the Google form, and also you share here. We will send to the Professor Sipes because her discussions actually were so nice, and I hope you answer and we can send her. Thank you. And any one of you want to speak can raise hand, please. We had very active participants last week and before that, but today I think you need more time to think about these questions. You can review the recorded sessions and slides and recorded videos are in the website of TUMS. Yes. How are you, Hamida? What you want to speak?
Hello, Dr. Darvish.
Hello.
My greeting to all, especially Dr. Nikbacht here. Thank you for your course for fourth session too. In fact, this session and last week, it was maybe because we are not in the practice of nursing informatics in a high level. So most of them is theoretical for us. So when you are not in practice, it is difficult to answer such questions. You know, it is very difficult. Because we not practice the nursing informatics in a high level. So it is difficult that idea come to us. We don't know what is the problem. How we can improve the practice, its practice, how we can use in more beneficial way and according our culture, our situation, our resources. So for this reason, I think we have nothing to say.
Okay, I got it. I think Professor Hebda wants to speak. Thank you, Shaya, for sharing your thoughts, dear Hamida. Okay, we can hear. Yes, Professor Hebda, please.
Thank you very much for the opportunity to be involved with a series of webinars. I know that my colleagues and I would be very happy to address any questions that you have. We're all at different stages in terms of where we are in nursing informatics. And as I said when I presented, I don't mean to say that we have all the answers. Sometimes we have experiences we can share that might lead you to do a better job. But we'll look forward to hearing from you. So if by chance you don't see our contact information, I'm sure you can contact Dr. Darvish and she will forward questions. Thank you.
Yes, thank you so much, dear Professor Hedda. I also think that the answers are depends to the ideas and opinion of each one of participants, depending their situation. For example, they are beginners, they have any experience of nursing informatics or not, but they are valuable. Your answers are valuable. And okay, the next one, Wahab Osman. Would you please
Hello.
Okay, no problem. Joe, we can hear you.
Hi. Hello, Dr. Thank you for
Darvish.
this opportunity to
Yes,
learn.
okay. Okay.
Oh, you want my video? I'm a little shy. All right. So I saw the questions from Dr. Sipes, Professor Sipes. So actually, it's very intriguing. Actually, I was trying to give chance to the other participants to answer first, so I didn't raise my hand immediately. So I can share a little bit about, let's say, question number one. So she asked about the value of monitoring to update competencies and practice. So I believe this is important because it will help organizations in their, for example, selection process on who will they take for as the nursing informatics role or staff or professionals, and also it would also influence or drive the curriculum for advanced educations, for example, for master's or doctoral degree, so that the students or participants that join their program would really benefit and would apply immediately the concepts and the knowledge that they gain from the courses. So it affects both the practical side for guiding organizations for selections, retentions, for professional development, and as well as in academic to make sure that the education that they provide would be relevant to the current practice of the healthcare.
Thank you so much for sharing your idea. Yes, you can also add something more if you like in future in the next weeks in those Google form questions. And the next
Sure.
one, yes, please. Yes, please.
Yes, I will do that. Thank you, Doctor.
Okay. And I think there was another one wants to speak. Actually, I didn't start my
Dr.
video.
Darvish,
Okay. Yes, please. Yes, please. Please, Dr. Azadi.
Okay. Sure. I also wanted to talk about the question number 5 about the expanded and evolving practice roles and competencies of informatics nurses. So I think, as mentioned in her slides, the evolving roles of nursing informatics would be more affected by those emerging technologies by 2025, such as applications of artificial intelligence or telehealth or digital health. And I also think that it's something, as Professor Sabs mentioned, we should, as we are developing the Master of Science in Nursing Informatics, it is some of those topics that we also should think about that when developing our course, although it's for the level of master. But I think those are really important topics that should be, covered in the education as well as the practice. So it was really helpful for us to think about that. I mean, as well as the project management, those are some really good topics to think about when developing the curriculum for nursing informatics. Thank you.
And thank you so much for sharing your opinion. Okay, and is there anyone else who wants to speak? Yes, Wahab. Okay, we hear you.
Okay. So, Osman.
Please, dear host.
Okay, so I'm Osman from Ghana.
Okay, Osman from Ghana. Okay.
This online tutorial on nursing informatics has really been very, very helpful. It's been very helpful because for us in Ghana and in Africa, especially the west of Africa or south of the Sahara, it's such that we have been over the years been used to so much use of paper-based recording and recording of our work and taking care of our patients, among others, and recording same and generating data and information on paper-based documents. Now, for instance, in Ghana last week, Mr. Yakubu indicated that the government is rolling out an e-health system, which it will involve, or which means that our nurses who are already in the system needs to get to know what nursing informatics is, what their roles are in nursing informatics, and how to use the new technology that is being introduced in taking care of our patients. For me in particular, I now teach at the university where I will be teaching nursing informatics next semester. So this online course has come in very handy and very helpful for me because I've been able to pick a lot of new things that I will be introducing in the course as I try to impart nursing informatics knowledge to my students. So it is coming in very handy. However, the issue is that nursing informatics as a course, not a full program, is just a course in the BSc program and the diploma programs of nursing training within the country of Ghana. So I am advocating and foreseeing that in the near future, we'll have a situation where we will have nursing informatics as a specialization, as a specialty course for nurses and midwives to pursue in other, because as we said now, things are gradually moving from being paper-based to being computer-based. A lot of our monitors, patient records, patient data, prescription, medication administration, even nursing care is now moving from paper-based to computerized and technology-based gadgets and devices. And if we don't move with the system, then you can't survive in this business of taking care of patients and nursing as a whole. Thank you. This is the comment I have.
That's great. Thank you so much. Okay, we received very nice answers, chat box, and also please you complete your answers or make them conclude to the Google form, and we will send to dear Professor Sykes. And again, thanks to Professor Sykes for very valuable presentation, and thank you all for sharing your opinion. Okay, and this is the time for my presentation. So please let me continue with sharing my slides. I want to speak about nursing informatics paradigm shifting. First of all, I should introduce myself. My name is Asieh Darvish. You all know that. And my journey to nursing informatics started from beginning of my BSc of nursing on 1990. It goes back to 30 years back. And when I completed my 4-year BSc, I was a teacher also. My main job was a nurse in the hospital, and also I had experience of supervisor. And after that, after working in a hospital in different shifts for 8 years, I went to India, and there I continued on IT in a IT college in India. And there spark came to me about the application of information technology in nursing. When I came back to Iran after 4 years, I continued to Medical Information Technology Management MSc, and after that, PhD of Information Technology Management, because in Iran yet we don't have nursing informatics academic program in the universities. and also some certificates in entrepreneurship. And also I am a team member of Tiger from HIMSS, and also I am a member of Asieh and Telenursing Network. I want to talk about trend of NI publications and explore prolific countries, how to identify the top sources of nursing informatics, and discuss about paradigm shifting NI. First of all, I want to attract your attention to a very famous sentence from Florence Nightingale to mention the strong history of nursing informatics. As you see, on 1873, Florence Nightingale talked about how accessing the hospital records can improve our decision making, and how it can has benefit on our money spending in the hospital and nursing care. And also, just I mentioned some history of nursing informatics. Actually, nursing informatics started even before 1984. But if we want to talk about scope and standards, it has come on 1995, and then it was completed and merged in 2001. And after that, professional organizations and specialized groups for nursing informatics developed. And many universities are teaching academic program of nursing informatics in the world, even up to doctoral level. And also nursing informatics is a subject for research in different countries. I want to say that for having a roadmap for the future, reviewing the literature, and also review the scientific productions and see their trends, and visualizing networks, especially scientific publication or network between authors and journals and countries, co-occurrence keywords, and something like this can help us to have a roadmap for the future. So in this presentation, I want to tell you my experience about the bibliometric analysis, how can show and can help you design the pattern of top authors, top countries, top institutions, top journals, and collaboration networks, and also the repeated keywords and the history of that subject, and also the paradigm shift. For that, last week, I again did a new search in PubMed and Scopus and Web of Science to show you how many publications are there for nursing informatics. Actually, this is 13,110 articles in PubMed, 8,922 articles in Scopus, and 5,679 articles in Web of Science, but they are based on my search strategy. You may change your search strategy and receive or retrieve more or less articles. In PubMed, I want to show you how publication by year will show you that in recent 10 years, how it is growing up, the number of publication in nursing informatics. And this side, you can see in the right side. And also how the number are increased, you can see here. And in Scopus also, it is the same. In Scopus search, we want to see the top journals. It's so easy. And if you search the nursing informatics there, you will see which journals are the top, and the most number of articles of nursing informatics is published in studies in health technology and informatics, and computers in CIN or computers informatics nursing, as you see here. And also you can see the document by author. So you can see top authors. You can see documents by affiliation and also countries. This was a question last time from one of the audiences. Which countries are most prolific countries in nursing informatics? And you can see here, United States is the first. And you see here the subject areas, and we can see more than 70% of subject area of these articles are medicine and nursing. This is also, again, about countries. These are 20 top countries. And the first one is United States, United Kingdom, Canada, Australia, Brazil, Taiwan. And here on the right side, you will see our country, Iran also. Iran with 72 articles. Here is 18th among 20 most prolific countries on nursing informatics. And these are some new articles there. Now, what about Web of Science? In Web of Science, as I told you, more than 5,000 articles were retrieved. And here also we see nursing is the most subject which was inside these articles. And also the countries, Web of Science published articles showed us that, again, the same countries name, USA, England, Australia, Canada, and Brazil are the 5 top countries on nursing informatics. And here in the right side, you will see the top 5 journals in nursing informatics. And about publication by year, you see that in the recent years, we have a growing up number of articles. And also in Web of Science, you can again see the top authors, the top sources, top categories of Web of Science, which the most one is nursing, and top research areas, most one is nursing. And the top countries, again, the five countries we talked about before. And here also, if you want to see which countries published about nursing informatics, all of them are inside this slide from retrieved articles of the Web of Science. So the last one is Latvia, and the first one is USA. And here also, again, Iran is 17th rank after Japan and Italy. So how I got this information, I just searched in Web of Science, PubMed, and Scopus, very simple. But after this, for the next step, if you want to know more and if you want to analyze the keywords and find out the paradigm shift of this subject, we need to visualize and have a landscape, scientific landscape. For that, I used VOS Viewer, and this is a free software, especially if our audience, some of you are students or teachers, you want to use it. It's free, and you can go to this website. This is the work of Van Eck, the professor of this subject, and has his publications inside this website. You can download and study them. Now, what will do this VOS Viewer? VOS Viewer will help us to cluster our keywords and do help in illustrating keyword frequency, co-authoring, network citation analysis. Now here, because I want to show you the paradigm of nursing informatics, so I choose this part from my article to show you the occurrence of keywords published in resources at least 10 times. When I selected them, then I found many beautiful results. And also, this US viewer showed me among these 5,790 articles, 10,133 authors were involved, and 91 countries were involved, and also the most number of articles published by USA as 42%. I put some slides just for your information and study after this session. These are the clusters the system VOS viewer prepared for me, and put the keywords which 10 times repeated in 7 clusters. Now, what is the use of these keywords? Before that, I show you the visualization of keywords, occurrence of keywords, and also we can have this visualization by year. These are the colors. Here you easily can see the dark blue are older. So the keywords which are in dark blue are older. And the keywords are in dark red are newer. So I put them in the columns. And by this, we can say, and in the past years, for example, from 1986, which articles published, nursing informatics focused on information systems and human-computer interaction. And it's intended to the next years to education and care quality. And for these 10 recent years, it's intended to telecare and self-care. And it's so beautiful. I remember in the first session, Dr. Azadi talked about how nursing informatics was focused on technology and now evolved to focus on information. And this here also we can see something like that. So the other articles, what say about this? I brought you one from Al-Ma'amar, which published on 2018. And they also, the authors mentioned that how we are going ahead on e-patient, e-physicians, smart hospitals, and some parts of Professor Saib's lecture today was talking about 3D printing or the new technologies. These all causes the nursing informatics paradigm is intended to patient-centeredness. And in this illustration, you can see, and you can refer to the article to know more about this. I also did a comparative study to see these countries, which are top countries in nursing informatics, what is the difference between them about the principles of Tiger. Because Tiger actually is a very precious project, which around 20 years is working on this subject, that how nurses can use IT in the way to improve the quality of outcome of nursing care. Not only nurses, but Tiger talks about all the health workers, but has a special focus on nursing. So in this article, we found that Iran, with 15 years of activity in the field of nursing informatics, is new, and the United States, with a history of 60 years of activity in this field, has been the most pioneer. After United States, again, United Kingdom, Canada, Australia, and Taiwan, all of them we compared based on the 7 pillars of Tiger. What were the 7 pillars of Tiger? Management and leadership, education, communication and collaboration, informatics design, information technology, policy making, and culture. And the focus of Tiger was on that culture is so important, and management and leadership should support and evolving area and development of nursing informatics. For example, by providing education based on their need and their level of nurse. As Professor Hepta lecture mentioned, the different level of nurses and different competencies they need. Also, I can say we have different actually subjects like digital immigrants and digital natives. And there is one article here I brought the reference for you about psychiatric nurses, and it says that most of them, or more than 50% of them, were digital immigrants. So some of them are born with computer and language of IT, and some of them they don't know how to use computers, but at this time they have to work with different systems in their workplace, and it's so difficult. So it means they need different level of competencies based on their need and their basic knowledge. What is the role of nursing leaders? Nursing leaders can merge competencies to nursing process. Actually, they should support merging competencies to nursing process, to nursing education, to shared vision, collaboration, communication, and change management. I feel that now after Professor Saib's lecture, you can get that these all are depends to scope and standards and nursing process, and also how project management can be helpful in this regard. In another article, we found that nurses, we have different nurses, beginning nurse, experienced nurse, informatics nurse. So we need different types of education. For example, nursing students, we should prepare informatics courses for them. If we want to prepare some improvement tools for postgraduate nurses, we should develop a Master of Science and PhD degree. And if we want to empower registered nurses who are working in a hospital, we should prepare continued educational programs or short courses like this short course. And for doctoral graduates, we should prepare fellowship programs. So these are mentioned going ahead, have more benefit. The sentence after us, I think there's that health is not only to be well, but to use well every power we have. And the power which we have today is IT. So try to use it better to improve our nursing care and quality of outcome of our nursing care. Thank you. There are some references here. You can use them. And thanks for. Now, I want to say thank you so much for participating to our program. Thank you again, all who supported us. And I will make on my video also, because it's the last time, I hope. Okay. And also, to Race team. Thanks a lot. I say Happy New Year to all Iranian and happy season changing to all participants from different countries. And I would like.
Yes, we have you again. You're muted, Dr. Darvish. And
Yes.
thank you very much for your nice presentation.
Thank you so much. Thank you for your collaboration. I really appreciate that. And please, dear participant, do answer the poll before leaving the session. Thank you so much. And I again thanks dear Professor Tony Hebda for being with us from the first session. And actually it was very precious, and all her colleagues, dear Professor Sykes, dear Dr. Rose, and actually it was a nice experience for me. And also I enjoyed the active participants. Thank you so much. Thank you. Okay, 15%. Okay, we wait more. 17, 19, 20%. Thank you so much. Please continue and answer the poll. Please be in contact, and if you like, you can join our WhatsApp group if you, for example, forgot the link of Google form, we will put that there. And after answering those questions, you will receive your certificate. And those questions are not for grade, just for evaluating. And we want to see how much we could change your opinion about nursing informatics and improve your knowledge. Yes, thank you. 57%. 56%. Thank you so much. Thank you staying with us till the end, and thank you especially who participated in our sessions. And some of you, if couldn't attend some session, can study from the recorded videos from the website of TOMS. We may have another program in after 1 month or 2 months. We will inform you. If you would like, can participate that also. Yes, 62%. I think it's okay. And thank you. Thank you so much, all participants. Thank you. Please answer the questions in the Google form to help us to improve and see what you need for the future if you want to repeat such programs, and see how our program, we can improve our program. Thank you so much. Okay, dear host, I think you can close the poll. Oh, you're welcome to the TOMS. Most welcome. Thank you. Okay, thank you so much. Yes, the results I can see. Thank you. Thank you for participation. And I want to say goodbye and see you again in future for next program. Uh, Thank you and bye. Again, thank you, Appraise to Raise team, for everything. Thank you so much.